My name is Hove. I'm a consultant ophthalmologist. I'm based in central London in the United Kingdom. Private practice is here in London Medical, and I also work out of the Platinum Medical Centre, and the NHS practice is Imperial College Hospital. So I perform about 2,000 procedures a year, of which 1,700 would typically be NHS patients in one context or the other, and then about 250 to 300 private patients. So at Charing Cross, which is my NHS practice, we use the Malosa single-use disposable instruments on everybody. It's a standard use. We use them on every single patient that we operate on. We started with Malosa from the beginning, and by the time we started with Malosa, the quality was already good. I remember initially single-use instruments, and I can't remember if they were Malosa back in the day, but the quality was variable. But now, especially from when we started, I think it was 2016, 2017, the quality has always been amazing. I actually prefer the single-use instruments to the reusable ones. Well, there's a lot of time and effort that goes into making sure that the instruments are sterilized properly and that they are returned in enough sets for you to be able to use them for the high volume. We do 26 cataracts on a day. So by using single-use instruments, we always have enough equipment available. Actually, our pack has been custom made, so each pack literally only contains what we need in every single case. And then we have extra instruments, ongs, vanners that are available as required. The quality is great, and then you have the added benefit that when you want to do bilaterals or anything like that, the disposable instruments are great because there's no risk of cross-contamination or infection when you use them in the patients. Especially for me, because I use the capsule rectus forceps for the start to end of the procedure. So I'll pierce the capsule, do the capsule rectus, all with the forceps. And so the quality of the instrument is really important. And what I like about them is that they're very narrow, they grip really well, and they work well through my 2.2mm incision. Okay, so that tiny incision, the way they're designed, I can do everything without losing any of the anterior chamber stability or with just this one pair of forceps. So I use it start to finish, no needle, nothing else, works every time. I can't remember the last time I actually asked or even had to bend them or actually asked for somebody to give me a second set because the first set didn't work. The quality is amazing. To a certain extent, it depends on how old your instruments are, and designs change. Our reusables aren't as well designed as this. So our reusables are much more clumsy, and the problem you end up having is I struggle to get them to open through the wound, especially with the 2.2mm incision, where I didn't find that the helium is escaping. So they're honestly much better than the reusable ones that we have. It may be just that our instruments are particularly old, but yes, they're much better than what we use. Well, personally, I think that COVID has given us an opportunity. It's given us an opportunity to reevaluate what we do. And when I say that, I definitely think that in low-risk patients, we should be getting to the point where we're doing bilaterals in the NHS. And the advantage that you then have with the Malosa single-use instruments is that there's a lot of work that goes on with reusables to make sure that you aren't using instruments from the same batch on both eyes. And once you use single-use instruments, that problem completely disappears. So if you're already using single-use instruments, you use them on both your eyes. It's quite easy and straightforward. If you already have reusable instruments, you could potentially use the reusable instruments on one eye and the single-use on the other eye, and then you don't waste the time that you'd spend trying to make sure that the way the instruments have been sterilized isn't in the same batch. It saves a hell of a lot of time for the nursing staff and everybody else, even peace of mind that you haven't got to worry that there's going to be an issue the moment one set is single-use. And if you use single-use for everything, then you win-win. I've been performing bilateral cataract surgery for the last 3 years. I would say that it's probably between 95 and 98% of the patients who I operate on my bilaterals. If I take the last year, I cannot think of one patient who didn't have bilaterals. That's only because she had one eye done. But almost everybody I do privately has bilaterals. The patients prefer it as an option. They want to be nervous once, they want to come to hospital once. And once they know it's safe, then it's their preferred option. It's their preferred option, it's my preferred option, it works really well. People have this, we do laser eye surgery, we do both eyes on the same day. if I was coming for my cataracts, given that if I potentially had cataracts in both eyes, then I want them both on the same day. If I'm having a premium lens, then adjusting to a premium lens, I've got a premium lens in one eye and the other eye hasn't been done, is much more difficult. So you want to put premium lenses in both your eyes and the patients adapt at the same time. The downtime that patients have after the operation. If both their eyes are done at the same time, it's like one recovery period, they're off work for next time. The benefits are many.